Hello, everyone. My name is Robert Bednars, and I am a junior doctor in Dundee, Scotland. And you're listening to the Patient Will See You Now podcast. I have to say, this podcast is for educational use only, and you should not be using this as medical advice or opinion. Please go see your doctor if you have any medical questions. This podcast is supposed to be fun and educational. So now that I got that out of the way, let's get into this week's topic. Hey everyone, welcome back to the Patient Will See You Now podcast. My name is Robert, and this week I'll be talking about retinal detachment, which, if you think you have it, it's a medical emergency, so please go see your doctor. I've never really had a problem with blood, intestines, seeing the insides of people's spread open rib cages, none of that. And actually, just hearing myself say that is really awesome, and it makes me really happy that I'm in a profession where that can all be possible without it being illegal. But one thing that always creeps me out are the eyes. Anytime I see any kind of surgery dealing with the eyes, it just gives me the shivers. It's just the weirdest thing to me seeing somebody asleep on the operating table and having their eyes wide open, letting their trusted doctors prod their eyes with surgical instruments. I enjoy watching horror movies, but something like this just really makes me feel a little bit uneasy. So, if you haven't guessed it yet, retinal detachment is a disorder of the eye in which, well, the retina detaches from the layers underneath it. So, the only sciencey thing I have to talk about is the anatomy of the eye, which, like always, I'll try to keep it simple. I'm not going to explain how we see, but I gotta admit, it's pretty interesting because we actually see everything upside down, but our brain is smart enough to flip it around so we see everything right side up. And if you haven't heard it yet, I totally recommend the song A Lack of Color by Death Cab for Cutie. Every time I talk about the eyes and how they see, that song always pops into my head. So, the eye. The eye is more or less in the shape of a globe. For some people, may be shaped a bit differently, and that's what causes people to be nearsighted or farsighted or even having astigmatism. Now, let's look at the eye from the side so that the front of the eye is on the left side and the back of the eye is on the right side. And since it's cut in half, we kind of see it halfway through. There are some tiny layers that we need to talk about. So, starting from the front on the left side, you have the cornea, and then an anterior chamber, which is filled with fluid, and the iris, which covers the lens and leaves an opening in the middle of the iris, which is your pupil. So when you see your pupil dilating or constricting, it's not the pupil getting larger and smaller. That actually stays the same size, which is just your lens. It's the iris, the color part of your eye, that enlarges the hole or makes it smaller, and it all depends on how much light is going into the eye. You don't want too much light going into the eye always. So when it's bright outside, your iris will constrict and make the pupil smaller. When it's dark outside, it wants to get as much light inside as possible, so the iris will enlarge and make the pupil dilate. If the person has dilated eyes outside on a bright sunny day, I can think of three reasons off the top of my head, and that's either they just had an eye exam, which they use special drops to dilate the eye, the person's on drugs, or the person is dead. After the lens, there's a big space called the vitreous body, which takes up what looks like about 80% of the eye and goes from the lens to the retina. Connected to the retina is the choroid, and behind that is the sclera. And these three layers, the retina, choroid, and sclera, wraps around most of the eye besides the front. So that's your eye. Now let's talk a little bit more about the retina since that's what we're talking about today. Let's zoom in on the retina. You have these tiny layers here that make up the retina. You have the retinal artery, which supplies the nutrients and oxygens needed in the eye, and also all of your really important nerves that are here to help you see. Here is also where you find your cones and rods. These are the funny names of photoreceptors, and they're named that way because of their shape. The cones are responsible for your color vision, and the rods are responsible for your ability to see in dark areas. All of these special nerves and photoreceptors get banded together, and then at the very back of the eye, sort of on the lower part of it, forms the optic nerve, one of the 12 cranial nerves, and it's what makes you see. Now, let's talk about retinal detachment. If you can imagine it now, if the retina gets detached from the other layers of the eye, you're going to lose the blood supply to those special nerves and photoreceptors and will impinge on your vision. How does this happen? In one of two common ways. Passively, by fluid getting accumulated between the layers, pushing the retina off, which happens slowly, or actively, where something is actively ripping off the retina from the other layers, like trauma, which can happen very quickly. There are many different types of retinal detachment, but the most common one is the one that's the most fun saying, which is regmatogenous, which basically means a discontinuity or break in the retina. Some risk factors people may have for retinal detachment are myopia or nearsightedness, and that's just because your eye is shaped in a certain way that makes it easier for the retina to detach from the other layers. Previous cataract surgery is also a risk factor, and also a posterior vitreous detachment, which is basically like seeing a large floater in your eye. Things that people will see who are experiencing a retinal detachment are an increase in floaters in the eye, which are just those things that you see in the eye that a lot of people actually have. It's really common, but with people who have retinal detachment, it's there's so many of them in the eye. Then you can see flashes of light that are unnatural and blurred vision. And a buzzword we like to use is a curtain like effect of your vision, where the top or the bottom or even both parts of your vision tends to just disappear, kind of like a curtain. Like I said earlier, a retinal detachment is a medical emergency and should be treated immediately. If the retinal detachment is not treated within 12 hours, there starts to be retinal degeneration, and you can permanently start losing your vision. This needs to be treated right away, and these are some of the ways that a retinal detachment can be managed. One way, which is the most interesting in my opinion, is something called a scleral buckle. This is when ophthalmologists will operate on your eye and insert a belt like band around your eye, squishing your eye just a bit. The idea behind this is that it squishes your eye slightly to help close the tear that caused the retinal detachment. So, for example, let's imagine your jeans are missing the button that closes them up. The flaps will just kind of stay open, even when zipped up, they're slightly sticking out a bit. However, if you put a belt on, it'll close the flap anyway. Get it? Good. Once the scleral buckle is put in, it stays in there for the rest of your life. Another management option is laser or cryotherapy, which is where they stop the detachment from detaching any further by either burning or essentially soldering the spots around it or freezing the spots around it so it doesn't detach anymore. There's also something called a vitrectomy, which is where they put a needle in your eye and just suck out the vitreous fluid that's causing the detachment. And lastly, they can insert a gas bubble in your eye, and this normally works easily for people who have the detachment in the upper part of the eye. The idea is that since gas naturally goes up, the gas bubble inside your eye will naturally go up as well, and it'll push the tear up against the back layers of the eye to close it. You have to sit in a certain position for hours per day, and the bubble usually goes away in about 2 weeks. Depending on where the detachment happened, the prognosis is actually pretty good for people who have retinal detachment. However, their vision is usually never the same and never comes back to 100% as they lose a bit of that peripheral vision. Again, that all depends on how long the detachment has been and also where it's located. Before we get into the interview, I just want to ask for a tiny favor, which is if you're listening to this on Apple iTunes or on any platform that has a rating slash review system, leave a rating and review for me if you're enjoying this podcast. I'm having a lot of fun making these episodes, and I hope you're enjoying them as well. And all I ask in return is a review and or a rating on the podcast so I can see if you're really enjoying it or to see on what things I can improve on. This also helps out the algorithm a lot to help other people find this podcast on different categories. If you did, then thank you so much, and I really appreciate it. So now let's meet Jake and hear his story on his scary experience of having a retinal detachment.
Hello?
Hello, is this Jake?
Yeah.
Hey,
Hey,
Jake, this is
how you
Robert
doing?
from the Patient Will See You Now podcast. How are you?
I'm good. How are you?
I'm doing all right, thank you. So, we're just going to crack right into it. I already talked a little bit about what a retinal detachment is, but let's just hear it from you. How did it start? What kind of symptoms were you having? And we'll just take it from there.
All right, so yeah, here's my story. I was 18, and I got hit in the face, and I got hit directly on actually the eye, specifically my left eye, on the side, on like the lateral side, so the side facing outwards. And as soon as I got hit, um, there was a bright flash of light. Initially, there was a very bright flash of light, and my vision blurred for only about 3 seconds, 3 or 5 seconds, and I started blinking because I thought maybe something got stuck in my eye, or like maybe like like I don't know, just something. I just started blinking, and it cleared up, and immediately went back to normal. And this was at night. Um, and I was didn't think anything of it. To be honest, I was pretty angry at the time, and I completely actually forgot about it until the next morning. The next morning, I woke up, um, and there was nothing wrong with my eye. Like my vision was completely fine, but I can't really explain it. Um, it felt it felt like there was something wrong with it. There was nothing. There was no symptom that I could actually just pinpoint. I spent maybe 20 minutes just looking in the mirror at my eye, like it just felt like there was something not right. There was no pain, there was no sort of vision loss or anything at this point. It just felt not right. Um, so I let it go. I didn't go to the doctor or anything. I was 18. I was still at the point in my life where I thought everything was complete. I was completely invincible. Um, and I don't remember whether or not I waited one more night or if it was the same day. I think I waited one one more night, and yeah, I waited one more night. So I went through my normal day. Um, I waited one more night, and I woke up the next morning, and my vision in my left eye, everything was completely yellow. It was as if someone just took a highlighter and highlighted everything yellow. Um, At this point, I'm still not freaking out. I had class that day, so I decided to go to school first and then go to the emergency room. Um, while I was at school, my vision in my left eye or slowly went from yellow to a dark, dark red, almost as if like looking through juice. Um, Still no flashes, nothing, just this dark red vision coming only from my left eye. Um, so at this point, um, I go to the emergency room after class. I walk in, and the doctor takes one look at my eye, um, examines my eye, takes one look at the inside of my eye, um, and immediately says, she looks up and she says, "You are having a retinal detachment, but it's okay. She said, some people fully recover from this." And at that point, my whole world just collapsed. I was like, some people? What does that mean? Like, what do you mean some people recover from this? And she said that uh, they wanted to take me by ambulance to a larger hospital that night to get me into emergency surgery as quickly as possible because retinal detachments are time sensitive. Um, because once you reach the macula, the center vision, recovery becomes very unlikely to recover full vision. Um, so I ended up not going to the ambulance that night. Um, and instead I was supposed to come back in the morning, because apparently I don't know the logistics behind it. I just couldn't get in surgery that night anyway. So I was supposed to come back in the morning. At this point, so I had the most horrible night. I thought this was the end of my life. I wasn't going to see in my left eye anymore. I had all these prospects in front of me that were just quickly disappearing. Life with one eye, I couldn't even fathom. Um, at this point, my mother had already bought a plane ticket up to come be with me. She arrived the next morning, um, and she took me on a plane. She picked me up. She brought me on a plane back to my home city because I was in college. I was not in my home city, and I come from a larger city in California. So it took me on a plane to my home city and brought me immediately to the emergency room in my home city, um, which would be UCLA. I'm from Los Angeles, so it would be UCLA, which is a large hospital with a very good eye institute. And I sat in the emergency room in Los Angeles for 12 hours before I saw somebody. The emergency the emergency medicine physician on duty came down to me. Um, she looked at me and said that she doesn't even know why she should call ophthalmology because there's no treatment for this, which was probably the worst thing I've ever heard come out of the mouth of a medical professional before. Um, but my family and I insisted on um, the retinal specialist being called down. Eventually, the retinal specialist came to see me. Quick examination of my eye, and he scheduled surgery for about a couple days later. And he said that at this point, emotionally, I was destroyed. I was like a zombie. I didn't care what happened anymore. I just wanted to get out of there. I thought I was never going to see again. I thought there was no hope, thanks to the emergency resident physician. Um, and this doctor looked at me and said, "I can't promise you anything. But I can promise you that we're going to try to fix you, and that here at UCLA, they have done amazing things for eyes. So I should be hopeful." And that lifted my spirits a bit. Um, I went through 3 days of being at home, just waiting for this surgery, which was probably one of the most agonizing 3 days I've ever been through. Just nothing to do, not able to do anything, only with my thoughts and Google, which is horrible. Never read Google. Um, if you're sick, it's just not. It doesn't help. There's nothing you can do about it. It just increases your anxiety. Um, so I had 3 days of that. I went to surgery. They eventually put it's called a retinal buckle. Oh no, sorry, a scleral buckle on my eye, which is they squeeze. They basically put a buckle, a belt around my eye, and they squeeze everything back into place. Um, because they want to try to push the retina back up against the wall, the back wall where it's supposed to be. And they also did I forgot the medical term for it, but they did an no, sorry, a gas bubble into my eye, which dissolves eventually. So the concept behind this is the gas inside of your eye will push everything back to the anatomical position. But unfortunately, from the area I was hit, in order for this to work, I had to be completely upside down. And I had to be completely upside down for about 23 and a half hours a day. So that went on for about 5 to 7 weeks. I got all the pillows on my bed. I slept upside down. I spent 20 like every I only got up to eat and to take a shower, and then went back to upside down position. I watched every season of Grey's Anatomy upside down. Um, it was now looking back on it, it's pretty comical. But at the at the time,
No, just
at the
just imagining somebody upside down for
no, yeah,
23 and a half hours.
that's exactly. It was absolute torture. I couldn't even. Not only could I not move, but I had to be upside down, and at this point, I was completely depressed, completely destroyed. I gained so much weight. because I couldn't do anything. I couldn't move. Um, the only thing I would look forward to every week, every 2 weeks was my next checkup to see if I was even getting better. Um, and eventually, hours turned to days, days turned into weeks, and I got better. The gas started dissolving. I was allowed to, after 5 to 7 weeks, I don't remember. It was a long time ago. I was able to not be upside down anymore. But now you have the problem of trying to get back to your day-to-day life with a giant bubble of gas in your vision. So basically, you're only using one eye, and the other eye. How do I explain what this looks like? It's difficult because it's a very personal experience that you have to explain. It's almost as if there's glass inside of your eye, and it's blurring everything. And but this glass moves with you, and you can tell that it's not anatomically part of your eye because there's a lag when it moves, and it's floating around, and you can pretty much control where it goes based on how you move your eye. And this was something I had to get used to because the gas would not dissolve for another couple months. Um, so there was that, and slowly but surely, I eventually went back to normal. The wounds healed. The gas went away. They couldn't even check the vision until the gas went away because it's because the gas is affecting my vision. So I didn't really know my full vision until a couple months later. Um, so eventually, I mean, I had to reteach myself how to drive. I had to reteach myself how to walk without bumping into things. When you're only using one eye, you completely lose depth perception. I would be at a restaurant or at home trying to grab a drink off the table and knock the drink completely off the table because I would hit it instead of grabbing it. I had to retrain everything. And eventually, after all was said and done, I went back to the doctor for my final checkup, and I was back to 2035 vision or 2030 vision, something like that. It was almost normal. In fact, it was better vision than what I started with because I was where I had pretty bad myopia um, and astigmatism, which contributed to the retinal detachment. But my vision was better than before. But the problem was that the macula did come off during my retinal detachment. So everywhere I looked in the central vision, there was a distortion, which means it was very hard for me to read with my left eye. Faces were distorted at the very central vision point. So that took getting used to. So I took maybe another 6 months of me doing my day-to-day routine before I started feeling normal again. Um, Luckily, your brain is very, very good at forgetting, at blending things together. And I went back completely to normal. I was driving again. I learned how to do things. Um, I learned how to grab cups. Like and I learned that whatever I think I'm grabbing, I should go a little bit farther, and then it became all automatic. And I was back to my normal life. I went back to school, and then um, so the first accident happened in February, and then I was better by September, and then in October, um, another retinal detachment happened. Um,
What?
yeah, there were two in the same eye. So everything that I thought I was at the bottom before, this was the new bottom. Um, I don't know exactly how it happened. I did get into, there was same person that gave me the old retinal detachment. We got into another argument. I was hit again, the same place, but the detachment did not happen immediately. I went to the doctor for a checkup to make sure that everything was still in place. They recommended laser and cryotherapy, which was something I was getting since the first retinal detachment, I forgot to mention that they do laser and cryotherapy with everything. So they try to freeze the retina on, and they also laser it. Um, so they do laser and cryotherapy. Um, so they recommended laser to reinforce my retina. They didn't tell me exactly what they saw, but they were pretty worried when I went to the hospital again. Um, they were doing laser, and as soon as I left the laser treatment, I stepped outside and I looked up into the sky, and I clearly remember this. Everyone has floaters, I believe. I can only speak from my experience, but I believe that I think everyone has floaters in their vision. But when I looked up to the sky, it looked like it was raining, like just dark rain. There was so many floaters, and they're like little dots. And this is something that they told me to look out for. Um, Small, like micro floaters, and like hundreds of them that look like rain. And this was classic that. Um, but I just came from the doctor, so I didn't go back in. I assumed that they saw that, and that's what they were worried about. So I left. Um, I left, and this was happened to be the same weekend I was going to a conference in a different city in San Francisco. So I drove to San Francisco that night, and by the time this was a Friday, by Sunday morning, same thing, same exact thing that happens to me. Sunday morning, I woke up and I noticed that my visual field was getting smaller and smaller. It, I couldn't explain. It's just you get this feeling that you're in a tunnel, and you don't really know where the vision is being lost because it's in your peripherals. But as it progresses, you can start to tell. It's like a curtain being draped over your eye, and it's happening by the minute. So it started for me. It started on the bottom, and just this line. There was just a really thick line that went across my vision, and every 30 minutes to an hour it's getting higher and higher and higher, and everything it passes is turning gray, like immediately just gray. You can't see anything. um, I drove to the hospital from San Francisco, directly to the hospital. By the time I got to the hospital, um, I had nothing left in my vision. They brought me directly into surgery. I woke up, I asked them what they did. They told me that they they fixed the sclerobuckle, which apparently had loosened. Um, I don't know how that happened. Maybe from the hit, maybe not. I don't know. And that they did the same thing, that they inserted oil into my eye, which is the same concept of gas. Um, but instead they use silicone oil, I believe is what they use. Um, and this is better because you don't have to be upside down, but it also degenerates much slower. No, no, sorry, it doesn't degenerate at all. You have to get another surgery to have it taken out. Um, so I went home um, at the bottom of my life just to redo everything I just went through the past 8 months. And yeah, slowly, little by little, I don't know what else to, it's just little by little, you start trying to recover your life. Um, Eventually you get so the silicone, when you look through the silicone in your eye, the whole experience of the silicone in your eye is that everything is also tinted yellow, and everything is distorted. It's almost like you don't have an eye that works. Everything is distorted. It's like looking through jello. It's exactly like looking through jello. um, and yeah, after 2 months, so this was October, 2 months, December, I was back to 100%. I just had silicone in my eye, but I could do anything. I mean, like my retina seemed to be steady. The scar tissue had formed. Everything seemed to be going well. I was doing well enough that I started working in a ambulance. Um, and as a firefighter, um, with silicone in my eye. Um, so my life went completely back to normal. I was active. Um, you get used to your handicap, your to things that handicap you. Um, and then eventually, I think 6 months had passed, and it was time to get the silicone taken out of my eye. So another surgery. They took the silicone out. I was down for about 2 or 3 weeks, and then right back up. I was used to this at this point, and I knew how it goes. I knew how it goes. Um, and then, as if that wasn't enough, the silicone when they opened the silicone from my eye, they told me that I was going to develop a very large cataract because of the exposure of the lens to oxygenated environment. So 3 months after the silicone was removed, I got my cataract surgery, which put me out for another 1 week or 10 days. But after that, after all these surgeries, um, I don't know. The only thing I can say is that you think you're going to be like down for the rest of your life, that it's like over, but it's not. It's just, there's there's so much you can get used to, and it's not even getting used to. I don't think about this anymore. This is not on my day-to-day radar. I live completely normal. I can honestly say I haven't changed one thing about my day-to-day life, about my dreams, about my goals. That nothing has changed because of this. Um, and the reason really I wanted to speak about this is because I don't think enough people know that this can even happen to you. I didn't. Um, that this is I consider um, maybe not life threatening, but life changing emergency that people should be very, very aware of. When I was growing up, I used to have a lot of floaters in my eye, and I went to an eye doctor, and they told me that everyone has them and not to worry without even looking into my eye. Um, I think that's completely wrong. Everyone should get eye checkups because you never know how fragile. I think thorough eye checkups. As often as you go to the doctor, you should consider getting your eye checked at least once a year, um, because people just don't know about this. This is not a common thing. People have heard of retinal detachment. I know it's not too common, especially for my age, but I mean, this is something that changes your life drastically. Um, so yeah, that's why I wanted to tell my story and try
Yeah.
to tell
Wow.
people.
Jake, I'm listening to this. We're already like 22 minutes in, and that was just there's so many ups and downs getting through that first retinal detachment and then just getting a second one. uh, I do have a few questions that I wanted to ask you if you don't mind.
Yeah,
Um,
yeah, go ahead.
I got them all written down. It's got this weird timeline going on, so I'll try to find my spots. But in the beginning, something that was really strange to me that you mentioned was that after you got hit, which by the way, did he just punch you or what happened? Like,
It was a slap. I don't really know. It was so I have myopia, which makes my eyes a little bit out of shape, and I guess more than usual, thanks to my bone structure, my eye does kind of like bulge a little out of its socket, which sounds weird when I say it, but I mean I don't look like I don't have bulging eyes or anything, but they just like slightly bulge out of my socket. So it's like not protected by the bone. So I guess when they hit me, it like clipped the eye at exactly the right point. The way the doctor explained it to me was that there was a rip in the retina when I was hit. By the force of the hit, there was a rip, and from that rip, there was a rip and bleeding started, and from that, blood got into the rip and slowly built up pressure behind the retina, ripping it off like a band-aid. So like imagine you had a band-aid on and you got a little water underneath. That band-aid's gonna come off.
ugh, it just imagine a band-aid on your eye. Oh my god! It just I mentioned earlier that eyes just creep me out in general in medicine. But
Yeah.
so the next thing you mentioned, which was so this was the super interesting part that I didn't find anywhere when I was reading up about it again. That your left eye went from a yellow vision, which is strange, and then to a dark red.
Yeah.
That
So
sounds like a horror movie. Like you're just looking through scenes of Carrie or something like that.
yeah, so that's exactly exactly what it felt like. But to be honest, at the time, I didn't take it seriously. I thought it was like a joke. I thought it was something that it would go away on its own. I was young. I didn't think anything bad could happen to me. It was the first real thing that's ever actually happened to me.
But when you say that
Um,
you were seeing dark red, when you looked in the mirror, did you see any changes in your eye, or was that just more internal?
no, it was completely internal. I mean, maybe my pupils were a little dilated. I don't remember. But so what they explained to me was that the pigmentation from yellow to red was my vitreous filling up with blood. So it was the bleeding that I was seeing. Um, which I mean, that's just the craziest part about all of this is that since it doesn't hurt, um, you're seeing it almost as if like you're a third party, but it's you. It's like you see like the I mean if you get your finger cut off, you're in pain, your adrenaline's going. I mean, it's you're not really like fully there, but here like you see like you see every layer happening. You see it go from yellow to darker yellow to
Oh,
red
that
to
sounds so
blood red.
strange. It sounds like you're breaking the fourth wall in real life
Yeah,
or something.
it's really it's really strange and it's horrible because you can't feel I mean I wish you could feel if I felt pain I would have gone to the doctor right away, but there's you don't feel it, you don't know when there's something wrong. I can't explain what it felt like before the symptoms started, like when I said that there was something wrong with my eye and I spent 20 minutes in the mirror looking at it. You can't explain it. I mean, I guess maybe every person knows their body differently. I guess the closest thing I could explain it to was it felt like there was a little more pressure in my left eye than normal, as if there was like uh, just like pressure, like wanting to break out. Not like in a disgusting, like explode kind of way, but just like a little more, like a balloon filled with a little too much air.
So it was just
Maybe,
really uncomfortable more than it wasn't painful or itchy or burning. It was just really uncomfortable, would you say?
yeah. I mean, I can't even say uncomfortable. It was like it's just I can't like you know when when something's not right. I mean, like you've how like however long you've lived in your body, and then you know when there's a change, even if it's not pain, it's not not comfortable. It's just something's not right. This feeling that something isn't right, and that it's maybe like I guess pressure. Pressure would probably be the closest thing to describe it. It's not exactly pressure, but this feeling of like pressure on your eye or pressing outward from your eye.
So another question I had, when you went to that first hospital and the ER doctor took a look at it, one look, and he was like, "This is retinal detachment," and you were your mom came to pick you up to take you to the bigger hospital. But what was that like? Did she come and she was like, "No, no, 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 you're getting treatment right now. We're going to this other hospital. Let's go." Like what happened in that situation? What was she thinking?
So my memory might be a little jogged on whether or not it was the same day she arrived that we went back, or it was the next day. It might have been the next day. But so she arrived in the morning. We went to the hospital. She's also a nurse, so she knows like so okay. So I after I went to the ER that night, I called her on the phone and I tell her what the diagnosis was. So I said, "There, I'm having retinal detachment," and immediately on the phone, she just breaks down into tears. And this is like, I mean, I know she's my mother, but it's like this is like because I see her as my mother and as a medical
Yeah,
professional.
the fact that
And
she's a
at this,
nurse and knows what it
yeah,
is. Yeah,
and at this point, I'm not looking at her as a mother. I'm looking to her as a medical advice. And her breaking down into tears
and you're
just
just like,
shot
"Oh
like
shit."
yeah, it just shot me into a like a deeper hole. I was like, I am screwed. There's no getting out of this one. There's like it's like this is it. So she bought a flight. She came the next day. She went to go speak to the doctor. She was really angry that they didn't take me into surgery. Um, and then eventually she was like, "That's it. We're going back home." I think we got a flight maybe that night. I'm not sure. Either that night or the next. I think it was that night because it was night when we left. That night, I went straight from LAX, the airport in Los Angeles, to the hospital, and I waited 8 hours to see a doctor. And that's when I met that emergency resident who is the worst bedside manner I've ever experienced in
And he
my
was the
entire
one. There's
life.
no treatment for this, right?
Yeah,
That
and
is terrible.
to give medical advice to because she's a doctor, she's giving medical advice saying that she shouldn't even see like ophthalmology. That's ridiculous. That's I when I spoke to ophthalmology finally when they came down, I complained about this resident, and they specifically asked me for her name, and the doctor speaking to me said that this was unacceptable, and that no one tells, because I was an eye patient, so he took me in as his own patient. He said no one tells my patients there's no treatment before I even see them. Um, so that was, I don't know, there was a lot of drama going on that night, and yeah.
So after that, you got the treatment. Was that when you got the scleral buckle? Was it that first time? It was, right?
So yeah, that surgery, that first surgery,
Was
because
that,
that night
yeah.
I didn't.
So,
I got a sclerobuckle and the gas.
and when I was reading about it, it's so strange. It's like, it looks like a rubber band, or exactly like you said, like a belt that goes around your eye. Um, is that when you said that it kind of feels like there's a piece of glass in your eye? Was it the scleral buckle?
No, 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 no. The glass would be talking about the experience of looking through your eye when there's a gas bubble inside.
Ah, okay, gotcha. So the scleral buckle, was that strange to have? Was that weird getting used to? Did you feel anything? Because that kind of goes under your eye muscles, and it just kind of moves when your eye moves.
So I mean, it's hard differentiating feeling the sclerobuckle from feeling the after effects of the surgery. Um, all I can say is about for maybe 6 weeks after the surgery, it just felt like there was no lubrication in my eye whatsoever. It was like you could feel everything moving. There was nothing went smoothly. It always felt scratchy. Um, I don't know if I felt the actual buckle, but the because it would after you get off the painkillers, you have they I mean like your eye is destroyed.
That's when you feel everything, right?
Um, yeah. The thing is which I also think is good, which I forgot to mention, is that you can't see out of your eye for like they cover it, and it's supposed to stay covered for like 6 weeks. So I'm only like the only time I'm seeing my eye is when I'm changing the bandage, which I think is better because you don't want to see that. It's only going to make you feel worse. But not only that, it's because something to do with yeah, movement. So I could watch TV. This was they said I couldn't read because because your eyes moved in synchrony in sync with each other. So if you're reading left to right for 12 hours a day, that's going to affect the gas in your eye. So the only thing I could do was watch TV because TV, I guess, is they said it was far enough where my eyes aren't really moving that drastically. But really, they didn't even want me to watch TV. They wanted me to just sleep.
But this was the only time where watching TV is better than reading a book.
Yeah, this was they were like it was insane. I cannot. This was the worst 6 weeks. And the thing is that there's no like support group or anything. Like I looked, I had nothing to do but just like watch TV, and there was and maybe like talk to people, but there's nothing. I mean, support group for people going through retinal detachments. I've never even heard of that. There is a company that makes special furniture so you can sleep upside down if you have a retinal detachment. That's it. That's about it. That's
Do you feel like that would have helped? Because I know you were saying how you were feeling really down, emotionally destroyed, is what you said. That you were just really depressed when going through the first retinal detachment and then the second one, of course. Do you feel like finding that support group, you think, would have helped you raise your spirits a bit, and knowing that other people experienced this as well because you must have felt pretty alone. Because even statistics now, there's only I think about 200,000 people in the states that have it. It's not that common. So, how did you feel with knowing that you had this retinal detachment?
So I just, yeah, I felt completely alone. And as I said, Google is not your friend when you have this stuff. I mean, people generally, you don't really go online to write about something unless it's bad. You don't go and write your like good stories just to tell the whole world unless like I mean, you go online. A lot of people in my experience go online to complain and to tell about their horror stories, which is the worst thing you want to hear when you're going through recovery process. But I mean, just a support group of people that know what's happening, can like talk you through the process, that would have meant the world to me because I mean, I had to figure this out on by myself. Me and my parents had to figure this out by myself. I had no idea what to expect. The doctors will only because doctors have to be realistic. They want to tell you they don't want to say you're going to get better and then you not get better. They also don't want to say you're not going to get better. Um, so it's hard for them because they're bound to like they're treating you.
Yeah, they always have that
Some
vague answer that maybe it'll get better, maybe it
Yeah,
won't.
exactly.
Yeah.
When and sometimes you just need like a human answer. You need someone to say, "Look, like it's probably going to get better, but if it doesn't, you'll be fine anyway." Like it's just sometimes you need yeah, the support group would have meant the world. I was alone. It meant it's and just with me, my parents who had little to no experience in this and Google, which was just driving me
Yeah,
into a
no,
deeper
we
depression.
everybody should stay away from Google from any kind of medical condition that they might have.
Yeah, it was not yeah, it was not easy.
So,
And it's no, go ahead.
sorry. So I just wanted to go back to that upside down phase because you said you were upside down for 23 and a half hours for 5 to 7 weeks.
Yeah.
That sounds impossible. How does that
I
work?
I thought it was impossible until you have to do it.
Like, are
Um,
you like a champ at keg stands now? Like, like,
so, so what I did was I was laying down. I just got my bed. I got all the pillows in the house, and so I mean, your whole body doesn't have to be upside down. Your eye has to be upside down. So
okay.
I I got all the pillows in my house, and I formed like a little mountain that I could lay my shoulder on and have my head lean off the side. And I got very adept at staying in this position through the night. Sometimes I would wake up and I would be in the wrong position. I'd immediately go back. Like, I mean, when you need to do something, your body will quickly um, start following the brain's orders to stay upside down. So yeah, I mean, I just stayed up. Just you stay. I stayed in that position um, for all day, all night. I got up to go to the bathroom, take a shower, and eat, and straight back to bed.
And was this like during the summer or something? Like, what? How did school work at the time? What was
I
going on at
dropped
that
out.
time?
I dropped out. I
You
couldn't do it.
because of
Um,
this retinal detachment, you had to drop out.
yeah, I said I mean I took out what's it called? I said I was gonna because I was gonna take the semester off due to medical problems. So I mean I guess I yeah it's kind of like dropping out.
Oh man,
I just
that's insane. Something that people wouldn't think is such a big deal. Something that happened to your eye, right? It's not like your leg stopped working, your brain stopped working, something to your eye, and you had to take a break or drop out from school because you had to be upside down for 5 to 7 weeks just to help you get better.
yeah
That's
that's something I want to make a point about in this podcast is that I want to because I was I worked with the fire department. I've had training in first response, first as a first responder, um, and working in the like a in medical capacity, and we were never told anything, never, not once, told anything about the symptoms of retinal detachment. There's a certain procedure every department has to follow. I can only speak to my department, and we wouldn't know what to do if someone called 911 because they. I mean, I don't know. If someone called 911 said they had flashes in their eye, um, we would have no idea. We would tell them to go see a doctor. But we wouldn't even tell them that it's probably urgent. There's no like system for this. And I think that there should be like if you find somebody with trauma who just experienced trauma to the face, and now they're experiencing flashes in their eye, this is like a priority one. They have to get to not just a regular hospital, they have to get to an ophthalmologist, specifically like, or is it ophthalmologist, but specifically like a retinal specialist immediately, because this is time sensitive. One day meant me being able to see normally for the rest of my life, or me not, essentially.
So yeah, it's usually in the books it says after I think 12 hours there's retinal degeneration, and you waited more than I think like about 36 hours until you got to see a doctor, and not until maybe a couple of days until the first procedure was done. So for you, like some damage has been done already.
Exactly. So that's what so I can't see central vision on my left eye, which is not a big deal anymore.
So
Um,
what does that mean? Like, can you explain what do you see out of your left eye at the moment? If you were to cover your right eye, what do you see in your left eye?
so for the most part, it's just like you're not wearing glasses until you get to like, if you look directly at something, and you can't tell if you're looking at a landscape or anything because there has to be high detail, um, because it's like it's the detail center of your eye. So if you're looking at, the best way to explain it is if you're reading a book, um, you cannot see exactly what you're looking at. And I don't mean like what you're looking at plus periphery, because it's it's just exactly what you're looking at. You can see the words right before it and right after it, but you cannot see the word that you're trying to read. So if you're going to read with just your just the affected eye, which I don't, but if you're going to read with just the affected eye, you have to read forward. I don't know if that makes any sense.
So what is it? Just black?
No, it pinpoints, so it goes into like a swirl. Think of like a black hole. It's not black though. It just disappears into like a blind spot right in the center,
Oh, that is so strange, actually.
and it kind of like swirls. It's not like it like everything swirls a little bit like a galaxy like you see in like pictures. It like swirls and then disappears in the center.
Or kind of like a when the sink gets full and you unplug it and it just kind of swirls in the middle,
Exactly.
kind of like that.
So so the way like eye tests. So right now I have 20/40 vision, which is phenomenal. But the way I do eye tests, which is, I mean, it works for me. I have 20/40 vision, but the way I read the eye test is that I have to look away from what I'm trying to read. It's the strangest. You cannot look at what you're trying to read. You have to look slightly off, and then you can see it.
Because you have to trust your peripheral vision to actually read the next letter.
Yeah.
Yeah.
I don't want to say actually peripheral because it's not like completely to the sides. It's just like off center. Like just slightly off center, you have to like look away. Um, but that doesn't affect me in my day-to-day life. I mean, day-to-day life, I thought I would never get to do the things I've done. I thought I would never. I don't think about this anymore. This is something in the past. But I mean, um, at the time that was that was heavy.
No, absolutely. That's a major deal. And then the fact that you got hit by the same person a second time and got another retinal detachment, what luck.
Yeah, I mean, I guess I'm lucky.
I
That's
ho-
like
are
that's
you still
that's
you're not friends with this guy, I hope, or anything now, right? Or
no, 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 no. That's over.
so do you still have the scleral buckle in?
Yeah, that's gonna be there. So yeah, it's still there. I get a check every 6 months to a year. I prefer to get it every 6 months because I'm paranoid. To be honest, the biggest scar is emotionally. Like you never know, like just knowing that everything's hanging, like it's not perfect, and knowing that this could happen again, because it did happen again.
Exactly, yeah.
Um, I would say that's the biggest thing that affects me today. But the scleral buckle is in the way they the prognosis for me is hopefully medicine will advance faster than my life. Like meaning that
That there will be
I
better
have,
medications when you're still young and they could do
yeah,
something. Yeah.
treatments. I mean, there's a lot going on in the field. They were doing retinal transplants on I think rats in France a couple of years ago. Just crazy stuff. But they my I was explained by a doctor that I have the eyes of an 80-year-old. then that was at 18. So I mean, like, we'll see what happens.
And is that scleral buckle, that belt, gonna be is like, right now, is it gonna be in there pretty much for the rest of your life?
Yeah, so I actually just went to the doctor a couple weeks ago, and I asked how it looks, and she said, yeah, it's going to be in there for the rest of my life because the point is they want it to form scar tissue, so it really gets in there. The most dangerous part for me, uh, for something to go wrong with all of this, I believe. I don't want to say 100% sure. I'm not a doctor, but what I was under the impression would be like the very beginning when it's fresh because there's no scar tissue to hold it in place. So even with the retina, when they laser it on, what they what I understand they look for when they look at checkups is the scar tissue. Um, so it like meaning that it's still stuck in place, but unfortunately on the retina when there's scar tissue, you can't see anymore. So I do have peripheral vision loss on my left, but it's to the side. It's to the it's like to the on my left eye going outwards. So on my lateral side.
Hmm.
So um, I'm very lucky it's on my lateral side because I don't see it. It just like I mean like I have to I don't notice it at all, and I can't understate how important it is to just have even the illusion you have your peripherals, because as soon as you don't have your peripherals, and as soon as you're looking out of just one eye, you start feeling like you're living your life inside of a box. I cannot explain. Like you wake up and it feels like you yourself is trapped inside of a box looking out, like a prison inside of your head. But as soon as you get use of both eyes, even if it's the illusion of peripherals, because I don't have my peripheral on the left side, but just like the illusion that it's there by having my left eye um, open and working, because so I don't have my peripherals, but your peripherals are never in focus anyway. You just see shadows. So it works perfectly because all I see are like these shadows in my peripheral, and you feel like you're getting the whole picture. Um,
That must have brought like some anxiety and just a whole bunch of other just depression, anxiety, and all that must have gotten brought up this whole thing too. And it seems like you're a lot better now, though. Is that what would you say that's correct? That you're pretty much okay and you're able to deal with it now?
yeah, I would say that. I mean, I've I've done everything I've wanted to do so far in my life. I haven't changed. I haven't made any compromises. That's one thing I don't like. I don't want to let this. I don't make compromises. Like as soon as I start making compromises, I start letting it define who I am by defining my goals. By I'm gonna shoot for everything I wanted before, as if this didn't happen. And if I'm not able to get there, I'm not able to get there. But it's not gonna stop me from trying to get there. But yeah, I mean, there is always that thought in the back of your head that it could happen again. It's something I have to live with. But I mean, it could happen to anybody. I mean, not to sound morbid or anything, but it's just like um, people do say that like, oh, which is something I don't find to be true, at least when it comes to me. People say that, oh, you did it once, you can do it again. Um, I hate that. That's not so like I don't know. I feel like that's not. Does anyone really believe that? Like, like you go through the worst thing that's ever happened to you. You don't come out of it saying like, oh, I can do that again if I want it. Like, I believe I can. I'm stronger because I can do it again. You want to do everything to not get back there.
Yeah, that makes more sense.
So I mean, I don't know. This, yeah, I mean, it was difficult the first year, but now, I mean, what am I gonna just you gotta not think about it. It just really helps that I mean I really do not think about it on my day to day, because it doesn't affect me anymore. Your brain, if there's anyone who's listening to this who's going through this, I don't know, but your brain will make up for your vision loss. You trust your brain. It's a beautiful thing. It'll make your life not only livable, but like you will feel like nothing happened.
So, Jake, we're gonna wrap this up slowly, but usually when I get to this last question, I get to this last question. I have this one question that I usually ask everybody, and it's basically for anybody else that's experiencing a retinal detachment, that's just gotten their first few surgeries, or knows somebody that has a retinal detachment. Because that's another question, is like, how should I treat somebody who has retinal detachment? What kind of advice would you give to those people?
Um, Personally, for me, I don't know how it is for everybody else. I don't like being treated like I'm sick. That does not help me. Um, I like looking forward and seeing. Um, looking forward. I don't like being treated like I'm sick. But if I could tell anybody that's going through it what I wish I knew back then, is that, first of all, don't ever read anything online. Listen to your doctor, because your case is specific. It's specific to you. You don't know about those people online. You don't know how old they are. You don't know how strong they are. You don't know anything about their doctors. You don't know where they got their treatment. You don't know how they have their retinal detachment. You're specific. Your case is, you can treat it like the first case ever, because it's the only thing that matters to you is your case, really. Um, and another thing is, whatever happens, you will get used to. Even if you can't use your eye again, um, you will get used to it. Your brain will make up for the loss. You will not go through your whole life living like you're looking outside of a box, looking at the world from inside of a box, which to me was the most horrifying part of this whole experience. Was I could not escape from this box, and if anyone is going through this, they understand what I'm talking about. Um, your brain will make that box go away. It all just takes time and patience, and just trust that eventually you will start to feel normal again, even though you are not completely 100% visually.
Jake,
And that's
thank you so much. That was this whole story. Honestly, I was coming into this retinal detachment. What more can there be to talk about? I can't. I didn't think a story like this would be getting me going up and down in emotions, and it just going through the first one and then the second one, and then how you described it. Like the one I think that stuck out to me most is after the second retinal detachment, you looked in the sky and it looked like it was dark rain. That just gave me shivers too. But I'm so happy that after everything you went through, after being upside down for 23 and a half hours for 5 to 7 weeks, after getting laser surgery, cryotherapy, silicone in your eye, a gas bubble in your eye, and the scleral buckle in your eye, all these things, all of these operations and procedures happening in one eye, that can really take a toll. I can only imagine that your eye has just had enough, but it's still going through. You've made it past. I'm glad you're in a position now that it doesn't bother you. You don't really think about it anymore. And that you got this 20/40 vision from somebody saying there's no treatment and they can't help you at all. That's an amazing feat. And Jake, thank you so much for being on this podcast and talking about your journey through this retinal detachment. I really appreciate it. Thank you so much.
Thank you.
Is there anything else that you want to mention before we go and finish this off?
No, I think I think that's it.
Perfect. Jake, thank you again, and I wish you a good evening, and I hope it all gets better, and I hope there's some better treatment to get that 20/20 vision.
Thank you.
All
Have a
right.
good night.
You too. Bye.
Bye.
If you liked this episode, please leave a review, and also make sure to subscribe or follow on whatever platform you're listening to this on so you can catch the future episodes as well. If you want to be a guest on this podcast, please send me an email with a background of what disease you're living with to thepatientwillseeyounow@gmail.com, and I'll let you know if you're selected to be on the show. Don't worry if I haven't gotten back to you right away, because I might get you back for a later show. And if your condition was already mentioned on the show, no worries. I like to show how one disease can affect different people in completely different ways. Again, thank you so much for listening, and catch you next week.